Welcome to Talking Heads on USA Global TV, starring the one and only wonderful Dr. JACALYN. It's a prestigious place where world-class influencers and experts meet, and where you'll find the most trusted advisors and coaches for all things in life and business. Visit usaglobaltv.com to sign up for our newsletter, get the value you need, and be first in line to learn about events and giveaways and other valuable content. Connect with us. Email Dr. JACALYN at usaglobaltv.com to talk about how you can become part of USA Global TV. That's USA Global TV, where the doctor is always in.
Hello and welcome to USA Global TV and Radio. I'm Dr. JACALYN KERBECK, and our show today is the Business Talk Show. Before we begin, I just want to do a selfish plug and ask you to go over to Amazon and purchase my new book, Adversity to Awesome. This is 12 chapters. My chapter is the first one, and then we have 11 fabulous authors who have written their own, one of whom is here today. My co-host, Mr. CINI, has the day off, and filling in for him is an incredible person, a very good friend, my own personal and business mentor. His name is ROLAND, and he is a co-host here on the platform. Our show together is the Mallorca Connection. He is also an expert presenter on our Talking Heads platform, and he is a certified elevated listener on our listening team. But wait, there's more. He is also the moderator and host for our brand new show, For Men, by Men, about men, and he'll tell us a little bit more. Traveling through Europe in his recreational vehicle, and here today to join us, Mr. ROLAND FRIEDL. Hello, welcome.
Hello, Dr. JACALYN. Great to see you again.
Nice to see you as well. So for our friends joining us for the first time, where are you in Europe?
Well, right now I'm in my home country in Austria, in the middle of Europe, parking my RV outside of the garden of my auntie's home to support her this week. To help her in the gardening because she's 82, and then I continue my traveling. I just came from Spain to Germany, and yeah, I will travel around Europe. And I guess I know quite a plan. The only thing I know, over winter I will stay in South Spain and Portugal to have it warm.
That makes perfect sense. And you just left, before you started your travels, you left the beautiful island of Mallorca, where you spent the last 14 years. So I'm going to spotlight you, ROLAND, and if you could share a couple of things. Tell us a little bit about your background, what you were doing there in Mallorca, and then tell us about the work that you're doing with men.
Yeah, thank you for this opportunity. Hello, everyone, whoever you're joining us. My name is ROLAND, and as you can hear from my accent, I'm not a native English speaker. I'm, as I mentioned already, I'm from Austria, a small but beautiful country in the middle of Europe. And I see myself as a world traveler. I was always traveling the whole world, working from different places. Actually, Mallorca has been my home base for the last 14 years, but I still kept traveling. As I always say, the world is my home, the world is my office. And what I do is, since over 3 decades almost, is we support organizations and the leaders worldwide, not only to perform better on the marketplace, to be more competitive, but the latest stuff we're doing for them is finding the right talents, but help them to bind them by developing and leading them. So bringing HR leadership together, because we strongly believe that those companies will survive not with the best products, but with the best talents on board. That's what my main business is. And besides that, I dedicate my life to men, because obviously I'm a man too. And I started a platform called Sparring for Men, where in a safe environment online, we meet internationally. We have English-speaking, German-speaking, a Spanish-speaking group right now, where we meet as a man and share our thoughts, our emotions, our anxieties, our doubt, whatever it is, and learn from each other to become a better version of ourselves, because men need men to talk about it. And I'm very happy that USA Global TV and Radio gave us the opportunity also to have our own show, a show, as you mentioned, by men, for men, about men. I'm very, very excited about it, because I strongly believe that when men change and become a better version of themselves, it will have an impact on the whole world, on the whole planet. And that's what really drives me. And not only driving my RV, but this mission absolutely drives me.
I love that. Thank you. And I believe our guest and you have some commonalities, some areas of interest that are going to be very exciting to explore. So she's been here before, and I'm excited to welcome her back. And I've been practicing her last name. Her name is Dale Keshishian. How did I do?
Keshishian, yeah.
Keshishian,
Perfect.
yes, thank you. She is the founder and CEO of HealthWorks Academies. She's an entrepreneur, a consultant, and an executive coach. We're going to bring her out and hear all about what she's doing in the world. Welcome to the show.
Thank you for having me.
It's so nice to have you here, and it's good to see you again.
It's wonderful to be back. Thank you.
So for people who are joining us and they haven't met you before, where in the world are you, Dale?
I am in the U.S., just outside of Philadelphia, in Wayne, Pennsylvania.
Beautiful area. It's called part of the main line of the Philadelphia area, so it's absolutely beautiful. We're excited to bring you back, and of course, so much has happened since we saw you, and I know it's impacted the work that you're doing. It's impacting the world. First of all, if you could just share with us, what was the impetus, the catalyst for you to start this nonprofit organization?
Well, you know, I was a medical practice manager for 18 years with my husband, who was a physician. And when I transitioned into a coaching position with a global firm, I realized that we have a real shortage of talent in the pipeline. We have physicians reaching retirement age and medical professionals reaching retirement age, and that has been exacerbated by COVID. People are retiring sooner, and the talent pipeline, students going from high school to college into professional health sciences, is insufficient for the demand that we're going to experience, and part of that demand is our senior population. We've got 10,000 people a day turning 65. Not only baby boomers, but millennials, and living longer as a result of advances in healthcare and services. And so we've got this increase in demand. We've got an increase in chronic disease, so obesity, diabetes, cardiovascular disease, stroke, again, putting demand on the healthcare system. And it's a $4 trillion industry currently, where virtually everyone is a consumer. So the question becomes, what do we do when we have an insufficient workforce and greater demand? And we live in a supply and demand economy where everything costs more when you can't get it.
Absolutely.
Thank you so much for sharing that. One comment I just want to make, I interviewed a physician. He actually is a plastic surgeon. He retired because he hit age 65. And he was talking about the burnout, the incredible burnout that physicians and people in the healthcare industry have experienced as a result of the pandemic.
That's absolutely true. And that was happening even before the pandemic. We saw the transition between physicians who had time with patients, took pleasure from their work. It was rewarding. It's the reason that they went into the work that they did. And then you know, the burden of having to see a certain number of patients every day, entering the information into a computer. You know, for younger physicians and medical staff that are computer savvy, that's not so hard. But for physicians that were older, that was more of a burden. Changing over from paper records to electronic medical records, was a transition. They felt like they had less time with their patients, and had, it impacted their ability to care for them in the way that they wanted to, and creating the relationship and maintaining the relationships that they wanted. So we've seen tremendous change, and then bring on COVID, right? So they're afraid of getting sick. Their staff may get sick. They may be short-staffed. The crushing demand in clinical setting, where where more people are ill and gravely so. So the demands to clinical medicine was just huge. And then the demand in the pharmaceutical industry to be first to market with, with a vaccine, to be able to develop and manufacture those vaccines and distribute them, and all the logistics that, came into play. And there's a broad range of professionals, not only clinical staff, that come into play in making access to vaccines happen, access to healthcare. It's a very broad issue, and then of course there's the cost.
So many topics there we could delve into. Roland, go ahead.
Yeah, I can absolutely relate to this, what you mentioned, Dale. We have the same situation here in Europe, and I can speak from Spain, where I spent the last year in my home country here. Many physicians retire right now. It's very difficult to find followers, and especially in the countryside. Majors in small cities, they pay for housing, for everything, to bring doctors in the field. And where I'm here with my auntie, it's a small town, but there's no dentist, there's no specialist. There are 2 general physicians, and she's 82, no driving license, no car. The next specialist is about 6 miles away. So for the elder people, it's really tough to get a physician and a health professional. And so we have the same situation here in Europe. With the pandemic, it even get worse. But for me, the pandemic was just a catalyst to show the gap we have in the healthcare industry. Yeah. And what we also have here in Europe is that the governments made the mistake that they forced the physicians and the nurses and whatever, to get vaccinated, and most of them didn't want them. So they left the industry, and the gap was even huger. So they called them back without vaccination. Please come back, because we have a lack of doctors, lack of nurses. My mom is in a residency, so there is a gap. They don't have enough people to take care. And it's absolutely an issue, because as you mentioned, we're getting older, we live longer, and we need care. This is a huge issue. So I highly appreciate what you are doing. It's all about finding the right talents, encourage them, and bring them to the industry. Absolutely necessary for the future.
We saw this way back in 2006 that it was coming, and it was a matter of time before we had a pandemic. I mean, this is not the first, and it won't be the last. But with even without the pandemic, just the increase in chronic disease and the number of seniors and the demand and the decline in students graduating from all of STEM, that has huge implications in the industry. So what we did was we developed a program that includes career shadowing across clinical medicine, biopharma, medical devices, healthcare technology, behavioral health, and I'll talk more about that in a minute. Research, especially graduate level research, which is understaffed. Finance, and we'll talk about that. Business and law and education, and for high school students that are currently taking STEM courses. We don't have a mechanism to introduce them to a broad range of all of the careers in those industries. And so in our program, our students shadow on average 40 careers a year across those industries. So they have a broad context of what they can do after their years in high school. And what is also missing in a lot of programs, and we refer to them as pipeline programs, to-end solution, to use a technical term. So we can introduce students to careers, but if they don't have the academic preparation, they're not going to be successful. And so we developed a custom STEM curriculum that's embedded with social and emotional learning, embedded with problem-based learning, so those critical thinking skills that are so important. And then leadership skills, that we call them soft skills, but we refer to them as power skills. communication, ownership of the whole, commitment to excellence, teamwork, all of those competencies that are so important to high-performing teams and in healthcare directly impact patient outcomes. And so if students have a strong academics framework and couple that with career awareness so they can find a career that they may never have otherwise seen or knew about, and then as students align on a career, we pair them with an industry mentor, and we know that industry is looking for talent. They're experiencing the shortage, and especially when it comes to diverse talent, they're putting a stake in the ground and committed to becoming diverse institutions, but they can't do it if they don't have the talent to choose from. So, and to include, and so we're looking to go into the inner cities and the rural areas and those areas that students may not have the academic proficiency and the career awareness. And we specifically designed the program so that our curriculum can be implemented in public, private, charter, and faith-based schools in urban, suburban, and rural geographies. And Roland, you mentioned the lack of healthcare professionals where you are, right now in a small community. We have the same issue here in our rural communities, and even in our inner cities that are, healthcare deserts. They're isolated in part from, even in the city, which you wouldn't consider, right? But we've got amazing advances in technology that can bring that physician connection and that healthcare connection through technology. But we need people who share the same culture, get the same buy-in and trust from the community to implement that technology and make it work for the patients in those communities. So that personal aspect is critically important to having patients participate in their care as opposed to a top-down doctor said you're going to do this and you do it, as opposed to being partners in their care and taking compliance and adherence personally as an obligation for a shared objective.
Yeah, but what I see is that all aspects of our lives following a trend. And the same is in education and professions. When I'm 57 now, and I remember when I was a student or when I went to school to become a doctor, we called them the heroes or the gardeners in white, was really something to achieve. So a lot of my colleagues went to university studying medicine and became a doctor because this was something in society was highly recognized, but it's not anymore here. So people go more, they find it more sexy to go in the IT or in other stuff. And I think that's one point is we have to make it attractive again to become a doctor or a nurse or whatever.
I don't think that it's lost its attractiveness. I think we have the numbers of students applying to medical school is quite high. And I was surprised to find that, it still remains 52% women. What we see is that there's an increase in Asian and Indian student populations in medical school, but for Black and Hispanic students, those numbers are flat, even as those populations grow exponentially in the United States. And so you have this mismatch of professionals, doctors, nurses, folks in pharma doing clinical trials, and on, that is not representative of the population we serve. And we need to close those gaps.
Great point. Thank you.
What's the reason for that? What do you say? Why don't you have enough for the Black community and Hispanic community following this education?
Well, there are lots of issues. first of all, they don't have role models. So if there's not somebody in your sphere of influence, and that's really true for any student anywhere, you're only exposed to what's in your sphere of influence. And so while the Black and Hispanic students may have people in entry-level positions in healthcare, they're not often connected with professionals. So that's one issue. The other issue is the quality of education. So we see huge disparities in the quality of education. So, when I was very young, I went to an inner city elementary school. And when I went to a suburban high school, my A+ grades were barely a C in a suburban school. It was very different. And I had a lot of catching up to do. And that still holds today. There's, so if you don't have the academic proficiency, you don't have someone in your sphere of influence, you don't have somebody who can mentor you and guide you and point you in the right direction and take you to work to see what it looks like, or share broadly in the industry to even let you know what's available and what you could potentially do and find something that you love. Those disparities will continue.
But but why is the education so important? I'll give you an example. When I went to school, I went to in a monastery, in a private school in a monastery, and I had a teammate, and he was really bad in almost all scientific stuff. He was really, really bad. But actually, his father sponsored the monastery, so he could train it. But what I want to say is, he became a very, very, very good physician. Absolutely, because he dedicated his life to it. But if he couldn't pass the school, he would never had an access to this job. But he's an amazing doctor. Even if he was not good in school in writing and mathematics and other stuff, but he became an amazing doctor. So I guess we also have to find a way how we can support people who really want to follow this path and help them through, overcome these obstacles.
Yeah, and that's where the education that meets students where they are, and a lot of the way that we deliver content in education is just mind-numbingly boring. And when you include problem-based learning, so you're learning a concept, but then you're learning the application of it. So it's a lot of hands-on, active learning. And we train the teachers that way too, who deliver the content. And then it becomes relevant. You pair that with career exploration, and then what they're doing in the classroom becomes relevant to where they want to go. So that chemistry course that they thought they could get by with a C is now relevant to something that they want to do. And so that so they become more engaged. So we don't have all the answers, but we have a program that really engages students, engages teachers, provides the teachers with everything they need. The other, one of the other deficits that we have is that we don't have enough STEM teachers, and science, technology, engineering, and math. And so when we designed our program, we wrote it so that it could be implemented by teachers with all different backgrounds, that when they have our curriculum, they know every step of every daily lesson plan to implement the coursework, the hands-on component, the social and emotional learning, and problem-based learning is included in every daily lesson plan. And it's really a great support for teachers of all backgrounds. We wanted to be able to get into communities where students, weren't getting everything that they need, and we needed to support the teachers to be able to do that.
Dale, thank you for sharing all this wonderful information. I have a question based on what you said a little bit earlier on, and we all know that relationships are key in any industry, in any agreement. And what I've experienced in my 59 years of going to see doctors, the experience was so different before than it is today. Today, you go in the waiting room, you know you're going to wait there for a while, then you get shuffled inside, and then you're waiting in that room, and then the nurse or somebody comes in to see you, then you're waiting for the doctor, then the doctor has 8 or 10 minutes to see you. It's almost like, I call it like a cattle call. It's just next, 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 where it used to be a completely different experience. And the reason I bring it up is that during the pandemic, I was able to meet through telehealth with 2 of my specialists at Penn. And what an incredible experience. They're in their home, you have a conversation. It's like 2 people that are real people talking. And so what I'm wondering is, in terms of recruiting people into these areas, how can we get back to that relationship as opposed to a transactional experience? Because I'm sure that the physicians themselves miss that too. And when we had this other doctor on, as I mentioned, he shared that 40% of a physician's time is entering information into a computer.
It's really stunning, and I think the pandemic really catapulted us to use technology in ways that we just didn't embrace before, right? I mean, who's not on a Zoom call at least, pretty often, right?
Frequently.
And thank goodness telehealth, telemedicine had been implemented prior to the pandemic, because it really, allowed us to connect with our health providers, nurse practitioners, physicians, and it was critically important. And from the comfort and safety of our homes, which was just huge. And I don't think telemedicine is going to go away. I think that there are times when you have to be in a physician's office if they have to do a physical exam. You can't do that as well with and in some cases not at all with telehealth. But I think that telehealth is a very efficient way to see patients and have that relationship, that one-on-one relationship without interruption. So you're right. It's a very different experience. I don't think, the office visit is going to go away. If you need an EKG or you need, something palpated, that's not possible with telehealth. But you're right, that relationship with the patient, that feeling that you're making a difference, the time that you're able to spend with a patient is critically important to being able to maintain the autonomy and satisfaction of our medical community. That's why they went into those professions in the first place, not to enter into a computer and be timed with every patient that you see, and having to see 20, 25, 30 patients a day.
It's overwhelming. And to your point, sometimes you have to go in, like, for example, I'm not going to do a telehealth and learn how to inject Botox into my forehead.
Exactly. Right.
But I understand, and I don't know how it is outside of the United States, but if you need to get a prescription refilled every 3 months, 6 months, you have to go in, or they're not going to refill that for you. Do you have that there, Roland?
No, well, during the pandemic, no, you just give a call and you go to the pharmacy shop and the prescription was already there. So this was easy way. And the challenges doctors here, physicians have here in Europe is it's over-regulated. So they spend a lot of time just on administration, and that's really bothers them. There's not enough time to see the patients. And this bothers both. The doctors themselves, they are not happy with the job they're doing. They're working like machines, next, as you described. And the client is not happy anymore. And I will call him not a patient, I will call him a client because he's paying for that. So we have the same situation here. And I don't know how it's in US, but in Europe, and myself, I go less and less to the doctors because I say I'm 57, almost 58. I know my body since 50 years. The doctor knows me for 5 minutes when I'm happy. So how can you help me? How can you help me? He doesn't know. No, because there's no time. It's not his fault because it's over regulation, over administration, and that's where we're heading on. And we have more and more specialists on this, specialists on there, specialists on this, and we don't have this general these healers that we had in the past that look at the whole body, that asking me, how was your sleep? Sorry for that expression, but my grandmother, she was a very wise old lady, and she said in the morning, how was your sleep? How was your shit? And what did you eat? Yeah, but no doctor asks you because they don't have the time. Yeah. They don't have the time, and that's what is missing. And bring it back because I see in my early years, my friends who went to university, they have been so motivated to make an impact in the health field, and then they become part of the systems, and after a while they just give up because they're in this machine.
It's not just part of the system, I mean, it's become an industry that's profit driven, and instead of being focused on patient outcomes and patient experience, and that's really where where we need to be moving, and of course saving cost, and the more we have demand and declining workforce, the worse experience that will be. But the other thing that really needs to be overhauled is the cost of education. On average, physicians graduate with about $250,000 in debt, and that forces them into specialties that over their lifetime pay more, and primary care, family medicine, internal medicine, pediatrics don't pay as well, and so it takes a lot longer to pay off your debt. And to be able to, if you want, have a family, buy a house, save for retirement. And a big consideration is we're raising a generation that will not have the funds to give back to community. And philanthropy is a very big, a very important component of how we support social issues in the United States. And so and that's really across the board, but particularly in medicine, because the length of education is so long and it's so costly. If you imagine 4 years of undergraduate education, 4 years of medical school, 1 year of internship, at least 2 years of residency, and for the specialties, much more. So they're really delaying their work lifetime, if you will. And so there's the need to go into specialties that pay well so that they can catch up.
Yeah, that makes a lot of sense. And, based on what we're discussing today, I think we should truly honor people in the medical field because everything that we're describing, they have a drive and desire to help people. They take an oath to help people, and then they get stuck in the big system. And in order to just survive and pay their bills, they have to see all of these patients in a row, and they've got to be physically, emotionally exhausted.
Yeah, there's no doubt there needs to be an overhaul. We need more professionals. We need I remember back when there was pushback about nurse practitioners and physician assistants, but they've been a godsend, especially with COVID and extending physician experience, and so we need more of them. We need to have students in high school know what those careers look like, and if they're maybe looking at medical school, but they're concerned about a very long educational pathway, and what happens if you don't get into a residency program, and that's a whole different topic and a very important one. What happens if you get into medical school and you don't finish, and you've got all this debt, and then you're not a doctor, and you need to pay those bills back, right? So there are alternatives that and different pathways, but students need to know that they can be in the profession, and it's not an EMT or a phlebotomist or a nurse or a doctor, and that's it. right? There's much more that you can do in the health field and have a rewarding and sustainable career.
Well, here in Europe, we don't have the financial issues. So all our universities, except a few private ones, they're for almost free. So here the students, when they become a doctor, they don't end up in debt. So it's a different situation. I don't know if it's a better one, but they don't start with deaths. By the end of the day, we have the same issues in the healthcare industry.
Yeah. Well, the debt issue is a huge issue. And that really impacts, people in graduate education across the board. And it's a big risk. These students are taking a huge risk when they take these loans out. So that's a real concern. And if we want more physicians, we have to look at the financial commitment and the barriers. And then, if we want to build diversity, well, what about those children who want to be a physician, but mom and dad can't write a check if they don't complete their education? They're in debt for life. Mm-hmm. And so what are we doing to encourage scholarships and loan forgiveness to make sure that we have a population of professionals that represent the populations we serve? And that's really important.
Dale, you just touched on something I wanted to ask you. So here, the current administration, the Biden administration, was looking at, I think they're still looking at loan forgiveness for forgiving student loan debt. And I read that there is sort of an uproar that the millennials are not happy about this. What are your thoughts about how that would impact the work you're doing?
Well, I think that if, it's not so much loan forgiveness, and certainly that's a big impact for physicians and graduate level education in healthcare. It's very expensive, and so those loans would really ease the burden. I think what we really need to be looking at is lowering the cost of education from the beginning. So they're not looking at loan forgiveness, but they're looking at a lower barrier to continuing education. So we've done this with we did the loan forgiveness for years with underserved areas. So if you were an internist, for an example, or a pediatrician, and you agreed to work for 5 years in a health desert, somewhere where in a rural area, for example, that one that comes to mind had one physician for every 11,000 residents. So if you agree to work there for 5 years, they would forgive your student loans. We've done the same thing with the VA when there's a shortage. You work for the VA for 5 years and they'll forgive your student loans. There are ways to entice physicians to work in areas that are underserved. What we really need to do is make that more available to students. So if you're, in medical school and about to graduate or going into a residency program in primary care, family medicine, internal medicine, pediatrics, where, if you that are so critically important to the professional services, the link to specialists and diagnostics and therapeutics, and it's sort of like home base. You've got that one physician that you have a relationship with who monitors all of your care, and your go-to trusted advisor. We need to invest in them, and we're not doing that sufficiently, and so we have this huge shortage in primary care.
So many issues that we need to delve into even further. But Dale, if people want to get involved, how can they help you with what you're doing, your nonprofit?
Well, one of the things that we're currently doing is because COVID impacted our ability to be in schools and implement new program. It's a new program, and COVID has really challenged our teachers tremendously. And so implementing a new program during COVID just wasn't going to happen. So we had to look at a different way to have students learn about careers. They still can do that. And so we've started what we were calling our masterclass series. And it's a series of panels in all of those subject areas: clinical medicine, biopharma, medical devices, healthcare technology, behavioral health, finance, education, law, where we have industry panels and the uh, industry professionals tell their story about what their almost certain future was in high school, what happened, how did they get to do what they're doing today, so it's relatable for students, and then about their academic pathway, what a day in life looks like, their what they love about their job, the commitment they're making, the impact that they're making. So students have that view of what they could potentially do, and our corporations are sponsoring these panels and follow-on mentoring programs to develop a pipeline from high school to higher. That mentoring relationship um, supports students from high school through their academic journey, undergraduate, graduate level education, and then a direct hire to our corporate sponsors. So we're developing our pipeline that way until we can get back into schools.
That's great. Thanks for sharing that. So we want people to reach out and support the work that you're doing. And if people want to call you, email you, connect with you on LinkedIn, can you share that information, especially for people who can't read the banner or they're listening on the radio?
Sure. Um, HealthWorksAcademies.org is our website. That's the best way to get in touch with us. The link is there for info@healthworksacademies.org. I have a LinkedIn page, Dale Keshishian. If you put it in, it'll come up. Um, those are the best ways to get in touch with us.
All right. Thank you so much. These shows go by so fast, don't they? We just started. Well, it's been an absolute pleasure having you, and please stay in touch. Continued success I wish for you, and come back and see us.
Thank you. And it's such a pleasure to join you again. I appreciate the opportunity to talk to you again.
Same here. It's nice seeing you.
Thank you for the work you're doing. I highly appreciate it. Bye.
Thank you, Roland.
Thank
Bye-bye.
you. Bye.
Thank you. Bye.
Roland, what were some of your key takeaways from the interview we did with Dale?
Well, as the same situation in the US and here in Europe, we have a tremendous need of healthcare people because we're getting older. Yeah. I wouldn't say we live healthier, but we're getting older. We have more issues, so we need more care and we need more health stuff. But for me, the takeaway is, if there's a gap in the healthcare industry, maybe each of us should have more self-responsibility and live a healthier lifestyle, so there's less need in caring in healthcare and in pharmaceuticals, whatever. Like I think every one of us can do something, work out a little bit, eat a little bit healthier. I wouldn't say an ascetic lifestyle, but a healthier lifestyle, and then you have less issues. I mean, they're both sides, you know.
Yes, very true. And something I'll share, I used to go to the physician to get an annual physical every year. And then during COVID, of course, I didn't go, and I still haven't gone. So I'm finally going next week. And I started calling around to get different appointments with doctors. And I think this is another part of the issue, which I forgot to mention. And I'm told, well, we can see you in December. December? No, I have a problem now. December is too late. So then I said to myself, okay, I'll just go to Dr. Google and I'll just start to self-diagnose. And I think that's what happens. A lot of people get dismayed because they can't see anyone, and they can't see anyone because the physician is literally jammed 20, 25 people every single day. And imagine when you deal with men who are burnout or women who are burnout. Imagine what that experience must be like when you come home to your family, or even if you're by yourself, complete
Absolutely.
and overwhelming exhaustion.
Absolutely. But here in Europe, we have a two-class society in healthcare. The normal people who really phone up the doctor and waiting for months for an appointment, even when the pain is or whatever. I'm luckily I can afford a private insurance, so I call the private clinic and I come the next minute. I give you an example. Normally here in Austria, when you need an MRT, a magnetic resonance therapy, you're waiting 6 to 9 months. I get them the next day or in 2 days. So there's a two-class society coming up. But the older you become, the more you invest, of course, in your health and your healthcare, of course. But as I said in the beginning, it's also about us really taking care about ourselves and having less need and less demand of this. It's good to have it, but we should have self-responsibility.
Yes, agreed. I'm going to spotlight you, and if you can share with our audience, how can people reach out to you, and when can they watch this new show about men? Tell us more.
Yes. So, first of all, about the new show, I'm so excited about that opportunity to share this on this channel. And thank you, Dr. JACALYN and USA Global TV and Radio, to give us this opportunity that we can bring the show on. So the show is called Wild at Heart. To be honest, it's from a book title, a book title by a man I really highly appreciated, by John Eldridge, who has been writing a lot of books about manhood. So it's called Wild at Heart. It's a real, authentic, uncut. This is a show by men, for men, about men. We start on Wednesday, May 18th, so actually next week. And we start at, actually I have to count it's 3 p.m. East Coast time, or 9 p.m. Central European time when you follow us from Europe. And yeah, we do it 45 minutes, and we discuss different topics, all about our men being whatever we are concerned about, we're worrying about, we think about, we are looking for, just men's topics for men. And I think that will be a lot of fun. And actually, to be honest, it's nothing new, because since thousands of years, we came together as a man, having a bonfire, a campfire, and have a deep conversation. And this we bring on USA Global TV. So we are on fire. And if you want to get in contact with me, the easiest way is to get on my website. It's my name, RolandFriedl.com. For those who are listening on a podcast and radio station, I will spell it for you. It's ROLANDFRIEDL.com. And from there, you can link, if you're more business oriented, you're a business leader, you go to my business side. If you want a coaching about maybe having the same weird lifestyle like myself, like traveling and living wireless life and work remotely from wherever you want, you can come to the coaching side, the wireless life side. And if you want be a more authentic man, a more open man, aware about your emotion, then go to Sparing for Men website. You're more than welcome. And it's not about that you have a need or a problem or a challenge. I just love to connect with you and hear about you, what your vision is, what you want to go, what triggers you, and just let's contact and build up a huge network to support each other. Thank you.
Thank you very much, Roland. It was a lot of fun doing the show with you, and I appreciate you filling in for Al. You did a great job.
Yeah, and hopefully he recovers soon and has a good time, and we miss him here.
Yes, we do miss him here. All right, my friend, I'll let you go for now, and look forward to chatting with you again soon.
Thank you. Thank you, Dr. JACALYN. Bye-bye. All the best.
Thank you. Bye. Thank you, everyone, for watching our shows or for listening on the radio. I really do appreciate it. I just want to share that what has happened here on this channel has been truly amazing. As many of you may know, it's shared in my first book, Behind the Green Screen. It started out with me having the opportunity to be interviewed on a radio station, which is Business Talk Radio out of New York. And then I really got bored of being interviewed every Friday. So I asked to take the show over. They said, no, it's never been done before. You don't live in New York. You're not an employee. You don't have the equipment. And I took the show over and fulfilled the rest of my contract. Then we went on Zoom, then we went on StreamYard, and we went from one show to 25 shows we have. And now we have 3 teams of people. And then on a personal level, I have 2 #1 best-selling books in less than 11 months. And Roland is a big part of what we're doing. He's a big part of our future. And so are a number of the other people. So the reason why I mention all of this is you can stay in your house and you can do the same thing over over and over again. Or you can reach out to Dale, and you can reach out to Roland, and you can reach out to me, and you never know where it's going to go. So I just encourage you to step into the unknown, walk through the door of fear, and find your passion. It's not going to come looking for you. You have to go and find it, and it's out there. So I just want to be in appreciation of Mental Health Awareness Month, and I want people to realize you're not alone. There's platforms like this all over the world. We want to hear your story. If you'd like to be a guest on our platform, please go over to our website, which is usaglobaltv.com. If you're watching our show on YouTube, which is one of our channels, please go over to USA Global TV and click subscribe so that you can be made aware of all of our content. Our whole purpose and mission is to provide education, entertainment, hope, and inspiration. So thank you to each and every one of you taking this journey with us. Thank you again, Dale. Thank you again, Roland. We will be back shortly for another show, which is semi-new. It's our second episode of A Woman's Prerogative. And we have women from various parts in the world who are joining us to talk about women's issues and gender equality. So that's coming up at 4 p.m. Eastern, 9 p.m. British Summer Time, 10 p.m. Central European Time. So do join us for that. Thanks again. Take care.